Cases climb as more are tested. There were at least 23,572 confirmed cases as of Saturday in the United States, a number that has soared as testing became more available. At least 295 people have died. More than 195,000 Americans have been tested, Vice President Mike Pence told reporters in a White House briefing. That total does not include county hospitals or health care labs, the vice president said. Pence himself was to be tested Saturday afternoon, along with his wife, after a staff member in his office tested positive. The staffer is doing well, Pence said, and neither the vice president nor the president had direct contact with the staffer. The White House doctor determined there was no reason to believe Pence was exposed, but Pence will be tested, given the unique position that I have as the vice president and as leader of the White House Coronavirus Task Force, the vice president said. The U.S. Food and Drug Administration on Friday authorized the use of the first rapid diagnostic test that could detect coronavirus in about 45 minutes. The tests will begin shipping next week, according to a statement from the California-based company manufacturing the tests. In a strategic shift, New York City and Los Angeles County health authorities recommended this week that healthcare providers avoid testing patients except in cases in which a test result would significantly change the course of treatment. Guidance from the Los Angeles County Department of Health, dated Thursday, said testing at public health labs would prioritize patients with symptoms, health care workers, residents of long-term care facilities, paramedics and other high-risk patients. Others were encouraged to simply stay at home. The recommendation reflects a shifting from a strategy of case containment to slowing disease transmission and averting excess morbidity and mortality, the guidance said. Guidance from the New York Department of Health directed healthcare facilities to stop testing non-hospitalized patients in an effort to preserve medical supplies. At this point in the pandemic, demand for unnecessary testing is contributing to the rapidly diminishing supply of PPE and leading to a decreasing supply of swabs and viral transport media used to collect diagnostic specimens for COVID-19 testing, the guidance read. Testing may play a more significant role after the pandemic has peaked, but as numbers climb, healthcare workers and state leaders have sounded the alarm on medical supplies beginning to run short. Unless we increase the number of masks and gowns available, it's a matter of time before most frontline healthcare workers are infected, said Dr. Megan Ranney, an emergency physician with Lifespan, a Rhode Island health system affiliated with Brown University. We just don't have adequate equipment and really reusing stuff. The CDC might be recommending that right now, but that's only because we don't have enough, she said. It is not standard practice in normal times. In New York City, now the epicenter of the outbreak in the U.S., Mayor Bill de Blasio called on Trump for help and said supplies may only last for the next few weeks. New York State has identified 2 million N95 masks for purchase, Cuomo's office announced. 1 million masks will be sent to New York City, while 500,000 masks will go to Long Island. Cuomo said earlier that masks typically priced at 80 cents were now $4, but said, "We need them." Masks are being donated to healthcare workers from a variety of places and industries, including dentists and woodworkers. Pence said Saturday that Apple was donating masks, too, which CEO Tim Cook later confirmed on Twitter. "We're donating millions of masks for health professionals in the U.S. and Europe," Cook wrote. "To every one of the heroes on the front lines, we thank you." The vice president encouraged anyone with spare masks to donate them, particularly people in business and dentistry, saying, "That story is literally happening all over the country. Look at the supplies of the N95 masks and pack up as much as you can spare," Pence said, "and drop them off at your local hospital, and it would be a great service to our country." The Centers for Disease Control and Prevention in new guidance this week said facilities facing a crisis should consider options to combat shortages that are not commensurate with U.S. standards of care, including reusing masks or using homemade ones from materials like bandanas and scarves. Hospitals have already reported they've had to get creative with how to make more masks and make them last longer. Some have moved to makeshift hospital facilities, too, with one Washington state community getting ready to open a 200-bed hospital on a soccer field. And de Blasio said his city will use every building we can to become essentially annexes to hospitals. Supplies are a major issue: personal protective equipment, gloves, gowns, mask suppliers, Cuomo said Friday. I am now asking all product providers, all companies who are in this business, we will pay a premium for these products.